My name's Hamish, I'm a pharmacist and I work at Queen Street Pharmacy in Upper Hutt. So a pharmacist broadly is a medicines expert. We're the guys that endorse or promote the safe use of medicines and the appropriate use of medicines. We also triage patients. Okay, so there's definitely some bumps. How long have they been there for? So we ensure that if we don't have the skills and knowledge to treat them, we refer them on to others. And we're educators as well. So we educate patients on their treatments and therapies, regimes, just to make sure that they get the best use of their medicines and the best health outcomes. Queen Street Pharmacy in Upper Hutt, it's a community pharmacy, so we're one of, actually a couple of pharmacies in Upper Hutt, but I would argue that we're the busiest. We work between 2 medical centres, so we get a lot of prescriptions from each of those. A lot of what we do is dispensing medicines. Thankfully at this pharmacy we've got technicians, so they do a lot of the paperwork, they do a lot of the orders. So when I come to work every day, my priority is just making sure that that medicine treatment is safe and appropriate for that patient and that it's correct, so that each patient gets the right medication. Usually it starts crusting over about 7 days, but you want to continue for 2 weeks after it's gone as well to make sure that the fungal infection stays away. We also counsel them on that medication. We're making sure that they understand what that medication is for, how to use it, and just any side effects or anything they might need to be aware of. If it's getting worse or spreading, pop back and see us. So pharmacists provide free healthcare information, so you can come in off the street, like in here kind of things as well.
Is it up here?
I do definitely think it's a bit of eczema. Before you go to the medical centre, we get a lot of patients that come in just to check with us. If it is beyond our skills and knowledge, then we do refer them on for a more thorough assessment. Did the doctor see them at all? No. So it could be worth just popping into the after hours clinic. Okay, so just a routine blood pressure check today, is it?
Yes.
We also do a lot of consultation services. Patients come into the pharmacy for the oral contraceptive pill, trimethoprim, which is a urinary tract infection antibiotic. We do vaccinations, we do nicotine replacement therapy, we do quite a few services, and that's all about just improving access to healthcare in New Zealand. Besides that, we do lots of advice and counselling about common conditions. So head lice, eczema, hay fever, colds, flus, you name it, we do a lot of that as well. To be a pharmacist, you need to be very organised and on top of everything all the time. There is lots of communication in pharmacy, so we're talking to the patients, we're talking to prescribers, we're talking to other team members in the pharmacy. Has she seen the doctor yet, and how long has it been? So she's not vomiting and there's no other symptoms, is there? With patients, we've got so many demographics. You've got children, you've got elderly and everything in between. You need to be relatable and make connections with patients, because the more connections you make and the better the rapport you have with patients, the better health outcomes they're going to receive as well. They're going to listen to you and they're going to take your advice and take that on board and practice that advice. You are going to have good days and bad days. Sometimes you're going to get yelled at. That's unavoidable. Some people are scared, some people are angry, so you need to learn to discuss things with those people as well. Pharmacists are accountable for every decision that we make and also the decisions of people in our team as well. Every decision we make or what we do needs to be justified by law and ethics. There's a lot of laws and ethics. Pharmacy hours do vary. Pharmacy can be a 9-to-5 job. Often community pharmacies are open late as well, so those are after hours pharmacies. I do a little bit of both. Today, for example, I'm working 1 to 9 so that we can cover those patients that need treatment after hours as well. Queen Street Pharmacy, Hamish speaking. So that morphine, it's meant to be 10 days supply at a time. So there's lots of different types of pharmacies. Studying to become a pharmacist, the first year is first year health science. You really need to focus because it's competitive entry to get into pharmacy or one of the other medical professions. The second, third and fourth year is pharmacy, so it's 4 years in total at university. And then the final year to become a pharmacist is an internship. You've got a preceptor who watches you and sees everything you do and signs you off as a competent pharmacist. As for the study itself, it's very science-based. So in high school, you'd be thinking about chemistry and biology, but everything you will learn anyway at university. You need to be enthusiastic and committed to learning. Key things are just working really hard and making sure that you're keeping up to date with the content. In pharmacy, like most other health professions, there is a process of continued education. So we're what we call lifelong learners. And every year we do have certain requirements that we need to maintain in order to get our practicing certificates. And every 3 years, there's even more again. So we're constantly learning and updating our knowledge and practices to make sure that patients get the best healthcare they can. Pharmacy is constantly changing. As we've got this ageing population, increased burden of long-term conditions, people are getting older, they've got more non-contagious diseases. We've got increased strain on the healthcare system, so we're having to get smarter, more efficient. For pharmacy, what that means is pharmacists stepping out of the dispensary. We have to do more consultations. We have to broaden our services so that we can meet increased needs of the community and maybe take away some of the burden from prescribers and hospitals. It's just constantly changing, so stay tuned. Let's try to clear this place up. I really enjoy making a difference in people's lives. Often you get to form really good relationships with patients as they come and go, so you get to know them and how their families are. When a patient comes in, sometimes they've got no idea what their condition is or what their medication is. But I really love to try and make that patient's therapy a little bit better. Everything lights up for them when you finally talk them through everything, and they've come back and they are taking their medications properly now where they weren't before. It is enjoyable, and sometimes you do make a real difference.